Hi everyone, my name is Jaimie Smith and today I will be presenting on Torreon, Mexico, a small industrial city located in the state of Coahuila in northeastern Mexico. The purpose of this presentation is to provide a brief history of Torreon, why it's often regarded as Mexico's worst ecological nightmare, lead exposure and risks, as well as the correlation between lead poisoning and children. Listed here are my table of contents. Like I said, I will be going over a little overview of Torreon, and I have my 5 figures listed on slide 4, 7, 8, 9, 10, and my summary on 11. So let's dive in. Figure 1 shows the map of Torreon. On the left, I have circled the Met-Mex smelter plant, which I will get into in 1 second. On the right, I have it circled in red, and the rectangular boxes show the residential neighborhoods next to the smelting plant. So Torreon lies on the Nazas River, approximately 550 kilometers from the United States-Mexico border at the center of northern Mexico. It is the ninth largest metropolitan area of Mexico and is often regarded as one of the main centers for manufacturing services and commercial agriculture. However, today Torreon is also a city known for its lead poisoning due to the metal processing smelter Met-Mex Peñoles, which I have highlighted in both of these pictures, located in Torreon. So for those who don't know, smelting is a process by which pure metals like copper, silver, and gold are extracted from ore that is mined from the earth. Smelting uses heat as a chemical reducing agent to decompose the ore which drives off other elements as gases and leaves behind the pure metals. The Met-Mex plant in Torreon currently includes a lead smelter, a lead and silver refinery, and a zinc refinery plant, all of which are surrounded by residential neighborhoods. The Met-Mex Peñoles plant started its smelting operations in the early 1890s and is the largest in Latin America and the fourth largest in the world. In 1908, a buffer zone was established to prevent human settlements near the smelter to prevent environmental exposure to fumes to Torreon. However, the buffer zone was not enough to prevent the exposures of heavy metals such as arsenic, cadmium, and lead coming from the smelter and affecting Torreon. Lead is one of the most toxic heavy metals and is easily detectable in the environment, as well as the human body. Lead in the environment can occur naturally or from various human activities. Industrial emissions from smelting factories may serve as a source of contamination, and lead exposure from factories can be through direct inhalation of fumes containing lead or indirectly through other sources such as soil or dust contaminated with lead, as is the case here in Torreon. The toxicity of lead has been known for centuries, as lead poisoning even dates back to the Roman times. Lead poisoning can virtually affect every organ system in the body and cause abdominal pain, fatigue, anemia, neurological symptoms, seizures, and in extreme cases, even death. Children are more susceptible to lead poisoning than adults are, as they often absorb more lead from their environments because of their central nervous systems still developing. In children, lead decreases intelligence, growth, hearing, as well as other neurological and behavioral problems. According to the World Health Organization, children are at an increased exposure to lead because they may possibly be exposed through pregnancy, but also because they eat more food and drink more water and breathe more air per unit of body weight, and also have an innate curiosity to explore their worlds and engage in developmentally appropriate hand-to-mouth behavior. They also spend more time in a single environment and often lack control over the circumstances of that environment. Additionally, the developing human brain undergoes rapid growth, development, and differentiation, and lead can interfere with these extraordinarily complex and delicate processes. The consequences of brain damage caused by exposure to lead are unfortunately irreversible and untreatable. Measuring a person's blood lead level requires a sample in which the amount of lead found may be measured in micrograms of lead per deciliter of blood. The CDC currently defines lead poisoning as anything more than 10 micrograms per deciliters. However, any sort of level detected is harmful. The impact of the smelter has been recorded since 1977, when it was recorded that people from Torreon had the highest levels of lead in hair compared to other Mexican cities. In addition, another study conducted in 1982 suggested that Torreon children had higher levels of blood lead in their bodies. It wasn't until the end of 1998 that local health clinics in Torreon received more reports of lead poisoning in school children who lived seemingly close to the smelter and decided to investigate. By 1999, the community of Torreon and physicians from local health clinics requested that the city and state government officials appeal to federal agencies to address the problem of lead contamination after discovering that 2,500 of the 2,700 children they tested had unacceptable levels of lead in their blood. In response to this, the Mexican Office of Environmental Health conducted a series of studies to further investigate the situation, and even invited the U.S. Center for Disease Control and Prevention, otherwise known as CDC, to investigate alongside them. Children in Torreon were studied greatly, and those living close to the smelter, as well as far away from the smelter, were assessed to see if there was any correlation between the two. As you can see in Figure 2, those who lived the closest to the smelter had the highest mean percentage of blood lead levels in their systems compared to those who lived further from the smelter. The main findings were that heavy metal contamination in soil and dust around the smelter site far exceeded background levels. A higher proportion, greater than 95%, living in the area closest to the smelter had lead in blood levels greater than 10 micrograms of lead per deciliter of blood, most averaging 30. Thus, lead concentrations in soil and blood lead levels were inversely related to the distance from the lead smelter. The data supported the fact that the smelter complex was and continued to be the main source of lead emission in the city. The CDC also found that ingestion appeared to be the main exposure mechanism for lead entry to the organism after soil and dust. Soil was the main contaminated environmental media, having concentrations above 400 micrograms of lead per deciliter after testing children's playground areas in residential soil, both close and far from the smelter. Some children even had to be medically treated for lead poisoning after receiving their results with extremely alarmingly high levels of lead. As you can see here in Table 4, you see in 1998 the levels of children from all ages are extremely high. So the Procuraduría Federal de Protección al Ambiente, or the PROFIPA, or the Mexican federal agency responsible for monitoring and regulating environmental contamination, ordered the Met-Mex Peñoles to reduce its production of lead and implement a series of remediation activities to reduce the burden of childhood lead poisoning in Torreon. Among the most important was the collection of more than 100,000 kilograms of dust containing high concentrations of metals in streets, highways, roofs, and houses using high-efficiency vacuum machines. This action was important as an environmental intervention house by house. Additionally, more than 100 families from the neighborhood from the highest levels of lead pollution were relocated to sites further away from the smelter. The program was carried out with a 3-kilometer radius of the center to the smelter complex. In parallel, the State Ministry of Health opened a clinic with toxicological, pediatric, neurology, psychology, and nutritional interventions, as well as social work and nursing services. It is clear that the intervention helped, as the levels of lead in children who were first studied in 1998 decreased significantly by 2010, as evident in this chart from the International Journal of Hygiene and Environmental Health. So, in conclusion, lead is one of the most toxic heavy metals and can affect every organ system in the body. Children are more susceptible to lead poisoning compared to adults as they absorb more from their environments as their bodies develop. Unfortunately, children and adults alike were negatively impacted by the Met-Mex Peñoles smelter in Torreon. as evident in the high blood lead levels and environmental samples collected. But after federal investigations were conducted, the Met-Mex Peñoles was ordered to clean up their mess and reduce the levels of lead and other metals that they had unintentionally released into the community of Torreon. Here are my references, and thank you so much for listening.